The Artevo 850 gives us a great visualization and depth of field, and the AT ELANA gives the patients an excellent vision in long, intermediate and short distance with an increased patient satisfaction. I chose this profession because I'm fifth generation of ophthalmologists in my family. We are a family of ophthalmologists since late 1880s. My great-great-granddad, Adolfo, was the first ophthalmologist in our family in 1885. We also have a research foundation, and we have several basic researchers that help us with ideas, and we combine the ideas of the clinicals and the ideas of the basic researchers, and this is all looking for the excellence that all our patients deserve. We see more than 100,000 patients a year, and we perform more than 10,000 surgeries, and 85% of my cataract surgeries are with premium lenses.
¿Qué tal? Buenos días.
I've done the first AT ELANA implant more than 1 year ago now, and I think in premium surgery we need a lot of personalization. There are different and loads of kinds of lenses in the market, but there are also thousands of parameters that the surgeons have to know in order to choose the best lens for the patients. Bueno, dentro de las trifocales hay muchas lentes distintas por las características de tu ojo. Fuimos pioneros en el implante de la AT ELANA, llevamos más de 200 implantes y funciona muy bien a todas las distancias. We analyze the lens with an external optic bench. This way, we know exactly the performance of the lens. We understood the three focus of the AT ELANA. We understood that the AT ELANA had a great MTF with very small amount of halos. The defocus curve of the AT ELANA meets the requirements that we search in a diffractive trifocal. It's very continuous, it's very homogeneous, and has a great long distance acuity. That is something that we look for nowadays with the diffractive trifocals. So we are going to do cataract surgery on a 60-year-old woman. She has a mild cataract. She's myope of 3 diopters, and we are going to use the AT ELANA so she can have glasses independent. She's a very active woman, and that's what she's requesting us. I think the Artevo gives us high amount of advantages. First is the ergonomics, that we can do surgery with the 3D system. Also, it's a hybrid microscope, so I can change at any point of the surgery to the microscope if I prefer that, without even removing the glasses as I am doing now. We have loads of observers usually during our surgery, so for teaching it's also a great system. The Callisto tracking allowed us to have that precision because it has a very good quality and is very comfortable to use. I like a lot the true color representation that Artevo 850 gives us, because we don't have too bright or too dark areas. All the color is very homogeneous and with a very high quality. I've been using the Quatera 700 now for a while, and I'm very comfortable. I think it's a great machine. It gives us a lot of advantages, but I would say that the chamber stability is one of them. So we chose for this patient the AT ELANA trifocal diffractive. It's the new lens of ZEISS with hydrophobic material in C-loop and with a very good behavior in the anterior chamber. The AT ELANA preloaded system is great for us. It's very safe, quick and easy to use. And not only for us as a surgeon, also for the nurses that help us during the surgery. So with the intraoperative OCT we can see the cornea there, and if we go down we can see perfectly the lens on the back with the posterior capsule behind it. Fue todo fenomenal.
Bueno, a ver, perfecta. Tiene su impresión.
One of the best proofs of all of this is the patient satisfaction. More than 200 implants nowadays in the clinic, more than 100 implants myself, and the patient satisfaction is great. We haven't seen any glistenings at all after more than 1 year of experience.
Mañana van a estar los dos parecidos y luego en unos...
We didn't need to do any laser enhancement in any of the patients, and this is something great because it also allowed us to use the lens in mild or mild dry eyes.
A, B, F, C, B.
Muy bien, muy bien, muy bien. Y abajo, y esas no me importa que se falle.
R, D, Z, T, G.
Bueno, eso es el 2020. ¿Llegas a intuir alguna de arriba de todo?
Sí, claro. H, K, N, S, T.
Perfecto, perfecto, perfecto. Muy bien, ¿eh? Está muy bien.
Hoy ha sido una sensación
Oye.
poder...
AT ELANA not only met my expectations as a surgeon, it went up over my expectations as a surgeon.
¿Cómo estás?
Muy bien.
¿Todo bien?
Todo fenomenal.
Bueno.
Mucho mejor de lo que esperaba. la
Genial.
verdad. No doy crédito. Maravilloso, esto es milagroso.
La verdad es que son avances enormes y es una lente buenísima la de ZEISS.
For the future, we are all going towards the 3D visualization, not only in cataract surgery, also in cornea as a cornea surgeon, glaucoma or retina.